Okay, so today we're here with Dr. Felicity Keough of Keough Chiropractic in St. Charles, Missouri. And we're going to be talking about the difference between conventional medicine and functional health. So, Dr. Keough, whenever I met you a few years ago, my life changed because I learned of the difference between the two. And I'd really like to hear, not that I'm not pro-conventional medicine, I am. That changed my life and helped me as well. But the functional health, the focus on functional health really gave me my life back, changed my life. So can you tell us a little bit about the difference?
Sure. So the difference between like conventional medicine, I like to call it traditional medicine versus functional medicine, is, conventional medicine is I'm a huge fan of them as well. Like without them, we could not, we need them. Like there's a place for conventional medicine. They're really good at saving people's lives, and if you need prescription medication, then that's why they're there. However, there's a lot of people that fall into this gray area where they're going from doctor to doctor, and they're not getting answers to certain health issues.
That was me.
And that was you.
Yes.
Yes. And you had been to, I don't know how many doctors that you went to.
7.
How many?
For 8 years, undiagnosed.
Yeah, all these different diagnoses, or maybe not a diagnosis.
Autoimmune disease, and I'll
all of it.
Go into more of that later, but yeah, I was withering away to nothing, and then you came along.
And that's why I felt called to go into, I'm a chiropractor, first and foremost, but that's why I felt the need to go into learning about functional medicine, because there is so many people struggling just like you. They just don't get answers. So, for example, like if you talk about a simple blood test, a traditional doctor is going to run a blood test, and they're going to look at certain markers, and usually the panels are very limited because insurance will only allow certain things to be covered, and a lot of times the patient comes back and they're told that there's nothing wrong.
Okay, that's what happened to me, because I was amazed when, I wasn't very happy because they took a lot of tubes of blood when I went to you, by the way, but
they took a lot more blood.
Yes, they did. But I was amazed because it was the first time after all those years that someone had sat down with me and showed me all of the different systems in my body and where those systems were. It was almost like I had a baseline established where I could start working from. And I had no idea that there were so many markers that were off, and it was very eye-opening.
And I hear that a lot from patients, and doctors aren't bad. Like they're so busy, medical doctors are so busy, and they have so many patients, they can't keep up with all of them. So you get your blood test with your doctor, and a lot of times you don't even hear back unless there's a problem. Mm-hmm. And so with what we do is, we sit down and we go over the patient's blood results. We spend a lot of time explaining, here's what's going on in your whole body, because we're not really limited by insurance. We can run a full panel and look at every single system in the body. So functional medicine is really looking at traditional medicine is really black and white. The test is going to tell you if you're high, low, or normal. Whereas functional medicine is going to give you more of a, maybe you're not in optimal, but maybe you're just you're functioning below optimal or above optimal. Whereas on a traditional test, you're not going to know that. So it just gives you a lot more data, a lot more perspective, and then the functional physician can help you figure out where we need to start getting your body back in balance without necessarily resorting to pharmaceuticals. Now, if you need pharmaceuticals, but so many patients I find they don't necessarily need those at this point.
Yes, and I was trying to get away from the medications because they were causing additional symptoms. One of the things that I noticed whenever I met with you, though, was I noticed this, I got an idea of areas of possible concern. And I remember coming to you and doing the blood work multiple times, and you saying, this number's it's more of a concern now, right? So we really need to focus on this. When I went to my doctor before, the blood work kind of looked the same in certain areas, but they said, oh, everything's within normal limits. Well, if it's within normal limits, it doesn't mean it's not an area of concern. And I think that was one of the biggest eye-opening opportunities for me was to say, oh my goodness, there were areas of concern years ago when I got blood work, but I didn't have anyone to sit down and explain that to me.
Correct. Yeah. The reference ranges that they use are so big. Mm-hmm. So you can, like for glucose, for example, you had some blood sugar stuff, right? So for glucose, your range can go all the way up to 115 and still be considered normal. But from my perspective, that is not normal. Like we need to work to get your blood sugars balanced, but it's not going to register on a traditional test as a problem until it becomes greater than 120, 125, and now you are in desperate need of insulin. Mm-hmm. So it's a very different approach. It's a very reactive approach versus trying to be more preventative and more proactive with functional health.
Yes, absolutely. And I remember the forms that I had to fill out. It's like almost a small book. I got to fill out a small book whenever I first started meeting with you. But you ask a lot of questions. You just wanted to know everything. And it was just a comprehensive study of my body. And I appreciate you taking the time to do that with me, because obviously it's worked, my health journey. For those that don't know, I've lost 60 pounds in less than 8 months under Dr. Keough's supervision and guidance. And not only that, but my autoimmune disease is in remission now, and my cholesterol's normal, and I could go on and on. But I just thank you for not only catching the things that my markers were off, but even showing me areas of concern that might not be causing a symptom right now, but would eventually lead to a symptom. So
it's been wonderful to work and watch you, because you didn't just lose weight. You've regained your whole health, which is just so rewarding, and that's why I do what I do every day, and that's why my office exists, to do that, because getting people back to their health. I mean, you've probably put a couple decades back on your lifespan, which is awesome.
Yes, I literally had a physician just say this to me this week. I had to go to the hospital for something, and everything's fine, but I was having pain, and they saw my old markers and said, wow, the changes that you've made have potentially added a couple decades to your life, and I contribute that to you. So thank you, Dr. Keough, for joining us today, and I really appreciate you. And I know we're going to be working together on a series of different topics, and so you all stay tuned for more enlightening information from Dr. Keough. Thank you.